Welcome to today's discussion on pandemic management. We are joined by two distinguished discussants. Governor Martin Kuba of the South Bohemian Region is also chairman of the Association of Regions in the Czech Republic. The governor brings a dual perspective as a senior public executive and a medical doctor that began his career working in emergency services. The governor formerly served as the Minister of Trade and Industry of the Czech Republic. Texas National Guard State Surgeon Colonel Peter Coldwell has been called to active duty and takes a pivotal role in the Texas Military Department's response to COVID-19. A physician for 24 years, and before that a combat medic for 8 years. He has 39 years of service in the U.S. military and has received training in numerous military medical programs. My name is Stephen Richards. I'm the moderator and I serve as chairman of the Richard Richards Foundation. I want to pay special acknowledgement to the United States Department of State, Office of Central European Affairs, for their valuable assistance in arranging this discussion.
For start, say a few words about situation in the Czech Republic. The situation was the same as the US. The situation in pandemic was very complicated in the Czech Republic. We had 3 waves in the Czech Republic, and last was the 3rd waves, which culminated in March 2021. And in the Czech Republic, the situation was very complicated because during the 3rd wave, the pressure on hospital system was very huge, and it was very complicated in the Czech Republic. Now the situation is relatively good, because the situation now is calm, and I think that now is the most important thing to find balance between how to bring life and the economy back to normal on the hand, and on the one hand, and limit spread of the Delta variant on the other hand, because people in the Czech Republic, and I think in all Europe and all the world, are frustrated and exhausted. And I think that now it's very important for governments and opinion makers to find a good balance for the future. And I think that it is a very important issue for our discussion, because now we can see a very different approach, for example, in Britain, when the government can lift all measures and all remaining measures. And for example, in the Czech Republic, then the experts and government are more careful than the Britain. For me, it's very important to see your opinion, which government is, which approach is good for you, and which way you prefer in Texas.
Indeed.
Sorry for English. My English isn't perfect. Sorry.
No, your English is marvelous. And I'm British, by the way. It's a long story how an Englishman ended up in the American Army, but I've been in the American Army now for 41 years.
So on this question, Colonel, that the governor proposes, he's speaking really of governmental decision process. You know, I know that you have highlighted some of the actions that Texas has taken in terms of addressing the needs of the safety and security of the people. In terms of measures, you want to talk a little bit about, you know, preparation for Delta in the sense of that safety and security. That really is where, you know, the key area of battle is, so to speak, is how do you manage that the health element of it, because that then drives the political decision making relative to the economic concerns.
I think I'd like to start, if you don't mind, just with a quick preface on where Texas is right now. So, and I believe it was about 2.5 months ago, the Governor Abbott lifted the mask restrictions within the state. And so basically everything went being open. Previous to that, masks were worn on the street. They were worn in businesses, hospitals, which are still wearing masks, by the way, in the hospital, and of course air travel. But we went into, we were now able to go to restaurants without having to wear a mask in, where previously we would have had to wear a mask in and then sat at the table. So interestingly, I report numbers to my general officer that I report to, Major General Tracy Norris. And I have not seen significant changes yet based on that decision to remove masking. However, now we delve into the Delta variant. So my experience of the Delta variant is very limited. I don't think we have a huge number of cases in Texas, but I can share with you my knowledge of the Delta variant as I've read about it around the world. Israel's had a very significant impact from the Delta variant. Most of their cases now are Delta, and they've recently come out with a mandate that even vaccinated individuals that are exposed to a COVID positive patient must now quarantine, because the Pfizer, which I think is certainly a common vaccine here in the United States and in Texas, and I think it is also used in Israel. But they're finding, initially it was reported that the Pfizer was 88% effective, and now it's been determined to be 64% effective. So while there is a risk of contracting the Delta variant if you're vaccinated, we've had no hospitalizations and or deaths as a consequence of that infection. So for the audience that will be watching this, I cannot emphasize enough that vaccination is absolutely the most important thing to do right now. So what are we seeing with the Delta variant? We're seeing it's much more contagious, as I think that is well established. About twice the number of hospitalizations in the unvaccinated. And we're seeing that a lot in the younger folks who've chosen not to get vaccinated. That seems to be a fairly common theme. We're seeing it in states in the United States that have less than a 30% overall vaccination rate, which is Missouri is one state that has suffered greatly from the Delta variant because they're low vaccination rates. So that's the experience there. So what am I doing for the state of Texas? I'm keeping a very close eye on it. I'm waiting to see if there's CDC, Center for Disease Control, recommendations on how we should proceed. I'm also waiting because I work for two masters. I also respond to the National Guard Bureau, who is our lead agency, and we fall under them. And they also provide guidance to us from Washington, D.C. They typically take their lead from the CDC as well. So depending on where the Delta variant is heading, and I do suspect that it will get significantly worse overall with the number of cases, that we might anticipate changes within the United States and Texas, but at this point, I really don't know what those changes are going to be. But it may require going back to masking, but at this point, that is unknown.
Yes, thank you. I think that it is a very important discussion about Delta variant, because I am persuaded that increase we are seeing in these days in Britain and other countries is due to spread of Delta variant. And I think that Delta variant will be dominant variant in all world during a few months. I think it's true, but it is very important if the increase in positive causes it isn't connected with increase in hospitalization. It will be good news, and I think that it is most important information for us for decision in the future. In the Czech Republic now, we have only few positive per 100,000 on 7 days, and in hospitalization we have situation very calm. We have no problem in hospitalization, and I think that it could be very important for specific decision to monitor the situation in our hospitals, and we have to see that Delta variant is a variant which only spread in a specific unvaccinated group. Without hospitalization, it will good news, but the complication could be when the spreading of Delta variant create new variation which will be more resistant or on vaccination. It will be problem. I think that we have no evidence for this in this moment. In the Czech Republic, we can see it in the moment.
So one thing that we haven't discussed in this question is there's still another variant heading this way that we're going to have to keep our eyes on. That's a Lambda variant coming up from South America, which may be even more difficult to contend with than the Delta variant. So, Governor, can I ask you a quick question? Within, as I just mentioned, within the United States, we see different pockets of the Delta variant and the effect of the Delta variant. Do you see that within the different districts and areas within the Czech Republic? Say, for instance, your area of command are you seeing different caseloads of the Delta variant or suspected Delta variant around the Czech Republic, or is it homogeneous?
No, I have to see no. We in the Czech Republic, the figures of positive is very low, and the situation in the Czech Republic now is very calm. And when we see to Germany, for example, Germany has announced change the condition for measures against coronavirus 2. The average number of newly infected per 100,000 inhabitants in 7 days will no longer play a key role in Germany. And I think that it is very good in this situation because now we need more detailed information about situation in clinic, because only numbers of positive, it is not important for us. Without hospitalization, it is not problem. But I have only one. I think that main problem could be the creation of new strongly mutation which will be resistant on fully vaccinated people which have whom have 2 doses of Pfizer-BioNTech. And I have to say that Pfizer-BioNTech is very quality and very good vaccine, and the most common vaccine in the Czech Republic.
Yes, sir. I completely agree with your assessment on that. I mean, Texas in particular has opened up greatly, lifted all restrictions, and pretty much everybody's back to a normal life. I think it would be very difficult for us as a state to have to reel that back in. And I think there would be a great deal of frustration and possibly even anger amongst the citizens of the state.
Yes. I have one question. What percentage of those vaccinated do you have in the age group between 20 and 40. Do you have some motivation program for young people? Because in the Czech Republic, we can see decline in interest in vaccination among younger people. For example, in my region, 80% people are vaccinated in group over 70 years of age, and in the group between 30 and 40 years of age is only slightly over 40%. And I see that we need to encourage young people for vaccination. And one step is that the PCR COVID tests, which are currently free, will have to be paid for unless they are accompanied by prescription. This is one step for motivation. And I would like to ask you, what strategy do you plan in US, and do you have some motivation program for young people, please?
That's a great question, Governor. Thanks for asking that. So I cannot speak for the nation. I can speak exclusively for the Texas Military Department. However, there is some bleed over also into the state. So the problem we have found is just as you have seen in the Czech Republic, that the acceptance rate for the vaccine is very low in the younger age groups. And I think that that's probably multifactorial, one of which there's been in that age group, social media is a lot more popular than it is in the older age groups. There's been a lot of negative focus in social media, Facebook, Instagram, TikTok, with respect to obtaining the vaccine. We still have citizens who fear that there's going to be some tracking device placed in the vaccine that can, and again, this is all based on their perception of the social media that they're seeing, has no bearing in reality, of course. The other factor that we're seeing is folks in that age group are generally healthy, and they feel that, okay, if they get sick, it won't be so bad, which is not in fact the truth, because we've had I'm sorry, I apologize, off the top of my head, I don't know the exact numbers, but there have been a lot of deaths within the United States and Texas in that particular age group. And that's because of lack of vaccination, and because of the feeling of invulnerability, and the belief that getting the vaccine will be worse than getting the disease. And so that's an effort that I'm making in the Texas Military Department, is to get out with some educational campaigns to emphasize the importance of the vaccine. So we're doing this type of a presentation that we send out to our force, encouraging them. I speak with groups when I can and encourage them. The commanding general is very strongly supportive of this measure, and she speaks to folks as well and puts out videos. But unfortunately, until the vaccine becomes fully FDA approved, then at least soldiers will be able to refuse it. Once it's fully FDA approved, the Department of Defense will make it a mandated vaccine, and we will be able to immunize our military forces.
Yes, thank you. The situation is very similar in the Czech Republic. And I have one question. What do you think about the approach of French government, which has decided that vaccination for health professionals will be mandatory? Are you thinking about something this?
Did you say French government, Governor?
French government has decided that vaccination for health professionals will be mandatory. All health workers in France must be fully vaccinated by September, otherwise they risk not being paid. It is a very strong step. And what do you think about it?
So this would be my personal opinion on that. I think that is too premature at this time to make that mandate. There have been several attempts with some hospitals within the United States to do that. It has not been well received, I believe. And again, I don't have exact details, just that which I have read, that there have been lawsuits pertaining to the attempted mass vaccination of healthcare workers. Now, Do I think it's a great idea? Absolutely. I think it's incredibly important that healthcare workers be vaccinated, and I would positively advocate for that. I had COVID myself back in July of last year, and then I was fairly sick. And then I also obtained the vaccine in December when it initially became available. But until such time, certainly in the United States, the Food and Drug Administration gives one of the vaccines, most likely Pfizer, full approval. I really don't believe that there's a legal grounds to mandate vaccination. There's certainly moral and ethical grounds to get vaccinated, but at this time, I don't believe there's legal grounds.
And Governor, I just want to add that I appreciate the Colonel's willingness to respond to questions that are outside his official capacity and express a personal view, but I want to be sensitive to his responsibility, which has a limited perspective, the military and Texas. So these are great questions. I think it's a fantastic discussion. We're here to promote the practices, right? We're debating the practices. So it's fantastic. I just want to make a point of order that the Colonel is being very gracious in responding, because he has certain limitations and responsibilities. So thank you, Governor. Keep going. This is very good. Thank you.
Thank you very much. Thank you.
Governor, other thoughts in terms of some of the testing strategies that you have had in your jurisdiction? You've touched on it already a little bit, but in terms of your own experience, for example, you made some decisions as a governor relative to that first, second, and third wave, right? Now you have Delta in front of you. Are there some other questions that you have? You've asked them, but and I'm going to ask the same thing to the Colonel. Does he have some thoughts that he wants to share with you, knowing that you have been through 3 waves and you have a new wave coming? But any other questions, Governor?
No, I think that for me that was a very good discussion, and for me the months with pandemic was a very good experience. On the other hand, as a doctor, and on the one hand on the doctor, and on the other hand as a governor, because the situation was very complicated. But for me, it's very interesting that pandemic very nearly touch the freedom of people. It is very specific for this situation, and I think that is very complicated for politicians and opinion makers, because when you sick, it is very normal that you cannot to do everything, and now the sick is all population, all people, and you have to impose very specific measures and curfew and others. And it is very complicated for communication. And I think that it's a very good experience for all politicians and all opinion makers. And I think that we can learn very much. Only not about pandemic, but only all people and society.
Thank you, Colonel. Thoughts?
So what I'd like to comment on is what my experience in the Czech Republic last year. So we got an urgent phone call, and let me back up for the audience, is the Czech Republic is a state partner with the Texas Military Department. So we have a very close alliance in that respect. So going forward, we got a phone call to see if there was anything we could help with. In November, I believe that the The pandemic was very severe. The caseload was extremely high in the Czech Republic. There was a hope that we could possibly offer actual physical support in providing doctors and medics to assist in the pandemic. Unfortunately, that capability doesn't exist yet, though that is something that came out of our meetings whilst I was there, and that's maybe 2 or 3 years down the road, developing a plan that will allow the Texas Military Department to come over and actually provide health care in the Czech Republic. But that's something that I think would be beneficial, and vice versa, for the Czech Republic to come to us. So that being said, I had a vacation in Prague some years ago and loved it. I was on the Charles Bridge. I couldn't move. There were so many people. So in November, we went back to the Charles Bridge, and I was leading this group of 5. We were the only 5 people on the bridge. I could not believe it. The restrictions were very severe. Getting a meal was difficult. And I think that was a good move on behalf of the Czech Republic, because that really did help to mitigate that wave that they were seeing going forward. My experience of the hospitals was absolutely stellar. I really had no expectation of what I would see. And unlike US military hospitals, the military hospitals in the Czech Republic also see civilians. And I believe that they were seeing more civilians as a consequence of the COVID at that time. And so I went in, I got great tours, nothing was held back. We got to see the folks in the ICU. We got to see the folks on the ward. I learned about the treatment protocols. And essentially, it was no different than what we were doing in the United States. I was incredibly impressed with the level of care that was being provided. I actually I shared that repeatedly while I was there. Also, the alternative care testing treatment facility that they had set up, I'm pretty sure it didn't get used, but that was remarkable. It had a nice intensive care unit built into it. Just very impressive facilities that they had. And I want to compliment the Czech Republic on the amazing effort that they have done over the past few months, because I know how hard it is. And it's probably even harder when you're a country that's surrounded by other countries that have different policies and procedures with respect to the pandemic, and the porous borders. The United States is pretty much isolated with our the Canadians to the north and the Mexico to the south, and we have pretty controlled borders. So I compliment and applaud the Czech Republic on their great efforts in doing what they've done right now, that they're in a much better place than they were just 7 months ago.
Thank you. Thank you very much. I think that our doctors and nurses and our hospitals in very good level, and I think that all doctors and nurses were perfect during all pandemic situation. Thank you very much.
Yes, sir.
Yeah. Well, thank you both. We will take this material. We will make sure that both of you have access to the raw material. We will produce through editing some packages, if you will, some products. We will share those products with you. Again, we want to emphasize best practices and the things that have been learned, and how to prepare, and the questions, the challenges. Governor, you raised this, dichotomy between medicine and economics, growth and freedom. It's a real challenge. So I just want to say thank you very much, Colonel.
Could I make a couple more comments?
Please.
First of all,
please.
I want to ask the governor. I cannot imagine that the position you were in, a physician and a governor, so a politician and a physician, did you, and this doesn't have to go on the record, I'm just very curious, did this ever present a problem for you, wearing both hats?
I think that was very good for me to have experience from medicine and ICU and from public sector. It was very good for me because I was able to imagine situation on ICU, and I was able to communicate with my colleague in hospital. It was very important for me in this situation, and I was able to very quickly prepare system of vaccination center in my region. We was first region with with high capacity vaccination center in all Czech Republic, and I think that it was good help for me, my history as a doctor and my experience from public sector. It was good combination for pandemic.
That's excellent, excellent. The only other comment I would like to make, and I believe it was going to be a question that didn't get asked, but how do we make this better? And one of the it's not one of, it is the most singularly important thing that we can do is maintain open lines of communication between our two countries. So between yourself and me, or whomever our designees are, that we share things that must, unfortunately, I know countries sometimes are less than motivated to share information for fear that they're disclosing something that's confidential. And I think in this case, at least on the medical side of the house, we have to be completely open, share best practices, share what medical treatments are working for you, what's not working, what trends are you seeing, how are you mitigating those trends. So again, I would like to encourage, and if there's any way that we can do that moving forward between the two of us, I still have my connections with the military, of course, out there, and I stay in close contact with them, but to maintain an open line of communication between yourself, myself for the Czech Republic, or whomever, just so we can continue this dialogue and share, because I've learned stuff from my Czech counterparts that I didn't know, and so that was very beneficial. And that's really my closing comment. Thank you.
Thank you for these words, and I have to agree, because I think that our partnership and friendship between Czech Republic and US is very strong. And thank you, Richard Foundation, for this meeting. Thank you.
Thank you, Governor. It was an absolute pleasure speaking with you today.
Thank you.
Thank you both. Like I say, we will prepare materials. You will have access to the raw materials. We will also share the edited versions. You're free to spread that around as you wish to promote and educate, as we have ended on this very positive note. Colonel, a real pleasure. I actually grew up in Denton, Texas. I have a very strong affinity for the state of Texas. And
wonderful.
Thank you very much. I appreciate everybody's flexibility, and thank you very much, Governor. Thank you, Colonel.
Thank you. Bye-bye.
Sure. Thank you. Bye-bye.